Welcome to Black Women's Health Podcast. I'm Dr. Rahman and I am a board certified OBGYN. But today is not about me. I have the pleasure of speaking with Dr. Giovanni Spinner. Good morning.
Good morning. How are you?
I'm well. I'd like to tell you what I've read about you, and then I'm going to ask you some specific details. Is that all right?
Absolutely.
Okay, so you have quite a CV. You are a public health strategist, in addition to being a TEDx speaker, a health equity champion, a DEI thought leader, a visionary leader, a speaker, and you've been recognized as one of the 40 under 40 health leaders. Quite an accomplishment.
Thank you.
That being said, tell me about yourself. Tell me about your background and growing up.
Sure. So, a little bit about me. So, I am from a small city in Virginia. So, I'm from Lynchburg, Virginia. And so, growing up, my parents definitely emphasized the importance of education. So, I was always interested in school. And of course, like many Black families, you have a couple of career options that are, kind of bestowed upon you, one being a doctor or a medical professional, and the other one being a lawyer. And so for a while, I was very much interested in being a practitioner. So I was very interested in dentistry growing up. And actually, my high school had a dental career technical program that I participated in and did really well in. And so that's, sparked my interest in, going off to college and majoring in biology because I knew I needed a science foundation in order to go on to dental school. So I did that for undergrad. I persevered through the program, but by the time I got to my senior year, I was like, this is not for me. I don't know what is for me at this moment, but I know it's not this. And at the time, I had a very limited mindset around what you could do with a biology degree. So I thought you could only, be in the medical profession or do research or teach. I didn't like research. I had a wonderful research experience with my advisor, but I just didn't like being in the lab day in and day out. I didn't really want to be in the classroom at any level. And so therefore I was at a crossroads. I need to figure out what am I supposed to do with this degree? How do I create a career for myself? And so I started taking some graduate level courses to explore my interests and kind of figure out, what I wanted to be when I quote unquote grew up. And so I took a pharmacy graduate level course. That didn't really do it for me. But then I took this course called, I think it was called like African American Issues in Public Health.
Mm.
And at that moment, the light bulb went off and the spark plugs and everything was starting to connect. And what I realized was what I was most interested in was community and population health. So I was more interested in looking at those broader systemic barriers that are preventing our communities from being healthy, getting the health care that they deserve, breaking down those barriers that impact our health outcomes, the social determinants of health that are those non-medical factors, so housing, transportation, education, income, et cetera. That's what I was most interested in. So how can we support communities and people to live healthier lives, but not that one-on-one individual practitioner level? And so from there, I went on, I got my master's degree in public health, and eventually I went on and got my doctorate in public health. And I've spent the majority of my public health career focusing on those issues, focusing on how do we close the health disparities gap? How do we address health inequities that our communities are experiencing? How do we build equitable public health programs that are truly serving the community, truly meeting people at their place of need so they can have the resources that they need to make decisions about their health? How do we make sure that we are infusing and integrating culture into our work? how are we, infusing the community's voice into our work? How do we bring them into the conversation? And so that's what I spent most of my public health career doing up until today. I still do that today.
Those are great questions. And I feel like I need to ask you, how do we do that? How do we address the public health issues within the community?
Well, it's really challenging. And I think the key is that we need to recognize that there's not a one size fits all approach. Yes, there are public health principles and theories and foundational things that you should do to design and create programs, right? But the key is, how do you integrate the voices of the community? Because they are the experts on their health. So we need to make sure that what we are designing is for them. And so making sure that they're at the decision, helping to make decisions about the program. I'll give you one example. So when I used to work at NIH, the National Institutes of Health, I was overseeing the Community Health Worker Health Disparities Program. And for those who don't know, community health workers are lay health people, so people who live in the community who have been trained to help educate and support others in their community around different health topics. Have made great impacts on improving health outcomes for chronic diseases, for cancer, and for other conditions. And so within this program, we had this curriculum, and we were partnering with housing authorities, so Department of Housing and Urban Development, and different housing authorities across the U.S. And this one particular housing authority, when we went and we were talking with them, what we found out was they thought the curriculum was great, but they identified smoking was a huge issue in their housing authority. So they wanted to take the session on smoking and start there and build the program around that. So that's a really good example of having those conversations with the community and figuring out what are the most important areas that we should be prioritizing. And then once they were able to capitalize off the information around smoking, they actually were able to implement a smoke-free housing policy. And so that set the tone for all of the rest of the work that they were able to do in addressing heart disease. We know smoking is a risk factor for heart disease, as well as other things related to nutrition, physical activity, et cetera. So that's just one example of making sure that, we are infusing the community's voice in taking their input seriously. Other areas that I've done that even more recently, so with my company, Beacon Public Health, we have several health education campaigns. So the most recent one is around maternal health. And one of the big components of the campaign is around storytelling. So we want to raise awareness around how do doulas and midwives help improve birthing outcomes, particularly for Black mothers, which we know are dying at 3 to 5 times higher than any other group in the US, right? But as a part of the campaign, it was very important for me to make sure that we had the mothers' voices in the campaign. So talking directly to them and asking them, what was your experience like using a doula or midwife, or both in some cases? And then helping to amplify their voices and share their stories, because in that way it becomes more relatable when you start to see people like you talking about the issues, and then more importantly, talking about what they have done to make an impact, right? Because we don't want to get bogged down into the woe is me, this is wrong, we're all dying, we all have, a chronic disease, but more so focusing on the positive aspects of, here are some tangible steps on how you can make small behavior changes. Here are some different mindsets around nutrition, like focusing on moderation and not a deprivation mindset. Like, okay, eliminate everything you've ever had that's unhealthy. That's not realistic for anybody.
Yes.
So making sure that you are talking to the people that you want to serve, I think that's going to be that is the most critical part of making sure you have an equity-driven public health program.
So that's really important, because one of the things that women often complain about is that they don't feel heard in the doctor's office. And so if we take this particular program that you've developed, the women come together as a group and they share their stories with each other? Or who hears, I guess my question is, who hears these stories and what happens as a result of these stories being told?
Yep. So great question. In this particular campaign, we didn't have the women come together as a group per se. So it is a multimedia health education campaign. So what that means is, again, we're meeting people with their place of need in terms of how they want to get their health information. So we have a mix of media. So we have a video that talks about the role of doulas and midwives. We also have print and digital materials, all downloadable. Everything in the campaign is free of charge. And so if you like, the physical feel of the paper, you can print it out, read it, share it, or you can, read it on your phone, computer, or whatever. We also have a toolkit that already has key messages and talking points. So anyone who wants to elevate the conversation, we've done the research for you. We've already done the work. So we have credible messages that are backed by the research, backed by evidence, but written in a way that is friendly, conversational tone, so you can help spark dialogue with whoever you are talking with. And with we also have social media graphics as well. So it's a mix of, some are like information and facts. So you need to know what the issue is. Others are talking about what is a strategy to help improve health outcomes for mothers. And then the storytelling piece, which has the mothers sharing their actual stories. We did do one live event. So we had a webinar, and that featured a panel of doulas and midwives talking about, this is what our actual role is. Because a lot of people I was finding didn't know the difference between a doula or a midwife, didn't know that they could have access to these services. So it was very important for me to bring that to the attention, not only for public health professionals who are working in this space, but for women, mothers, family members, because as one of the panelists referenced during the panel was like, birth work is family work. So we need to make sure that we are including all of those people who are going to be supporting this mother during her entire birthing journey, from preconception all the way through postpartum. And so that was a good conversation and a dialogue, and we plan to have more of those conversations in the future. So therefore, we have this good mix of materials for people that they are able to download. The campaign is called Mamas for Life, because I believe wholeheartedly that every mother should be able to come home and raise her baby. No child should have to leave and not have a mother. And like you mentioned earlier, the biggest issue is Black women are not heard, valued, or respected in the healthcare system. Makes no sense that a mother is complaining about an issue and she's not being taken seriously. So many maternal deaths are totally preventable. At least 60 to 80% are preventable. And that prevention starts with listening and understanding and being willing to give this mother the treatment that she deserves early on, and the appropriate treatment.
Okay, so I'm starting to see how you might have become one of those 40 under 40 health leaders. It's starting to become clear to me. But what made you decide to start your own company?
Oh, great question. So I am definitely one of those people who left their good government job. That's unheard of. They're like, oh my gosh, you're going to leave the federal government. And don't get me wrong, I absolutely loved my time in the federal government. I was very fortunate to have positions that directly align with my personal mission and value. So I was very fortunate in that way. But it just became a point in time where I wanted to create the programs that were most important to me, making sure that my work most aligned with the causes that I was most passionate about. So chronic disease prevention is definitely something I am totally interested in. That was my master's level work, my doctoral level work. It's been the foundation of pretty much my whole public health
Are we
career.
speaking of hypertension, diabetes, or
Yes,
something else?
yes. No, definitely. All the things that are killing Black people. So hypertension, high cholesterol, high, um, did I say diabetes, high blood pressure, overweight and obesity, and
Mm,
those being risk factors for heart disease and stroke, which we know stroke is the #1 cause of disability in America. So those are what I'm most interested in, and particularly looking at it from more of a social and cultural perspective. So the other campaign I developed was based off of my dissertation research, and that focused on how can Black women lean into their social and cultural factors to help support their weight journey, and live a healthier life.
we'll
And so
talk about that a little bit, but please go ahead.
yeah, yes. So to answer the first question, that's really why I started my company, because I wanted to make sure that the work that I'm doing is authentic and meaningful to me and to my communities, and can be done in the way that I think that it should be done. Of course, backed by research, public health policies, principles. I'm not out here just
Sure.
rogue making up stuff.
And so the goal is the information that you gather or the programs that you create are then taken to corporations, government, or how do the changes then get implemented?
So great question. So that's kind of where we are now. So my company is pretty young. I officially started it in 2021. So we're still a toddler right now.
Yes.
And that's my hope and that's one reason why I wanted to make sure that all of the materials are accessible. That's why they're free of charge. So anyone can go to the website, Beacon Public Health, and look at any of the materials. And in addition to the two campaigns I talked about, one, Mamas for Life, the other one is Unwind with the Tribe. That's the one focused on Black women and obesity. There are other articles for public health professionals to help them do their work better, but also consumers who just want information on how to live healthier, how to infuse wellness into their life to be the healthiest that they can be.
Right. To be clear,
Um,
so this is on your website,
yes.
and as a Black person, if I have some question or concern about my health or how I'm being treated or healthcare in general, I could go to your site and find all of these resources.
Yes, you can find those resources. Yep.
Okay. All right.
Yep. And we are continuing to add to the repository of resources. You know, as we get more information, as resources allow, I definitely add on to the resources as well.
And to better understand, going to your website, much of the material is informational for me to assume, but I can also participate in studies if I choose to.
No, no, no. We don't do any research studies. So we're not doing any research or clinical trials or anything like that. So we are focused mainly on health education. So the
Okay.
information that you're seeing on the website is just going to be health, education. Now, we do participate in research for our clients. Like we're currently working on a research project for one of our clients, but that is outside of our direct portfolio work that we are
So this is
spearheading.
reliable information that's germane to me as a Black person.
Yes.
Gotcha.
So, for example, some of our articles, you may find information like how do you incorporate physical activity into your day-to-day life? So that we may have an article about that. We may have an article about, it's new year, new you. How do you set goals for the year? Things of that nature. There are other articles around like nutrition. The Mamas for Life campaign has a series of articles that are just about maternal health. So it's really about raising awareness about these issues that are impacting our communities, but also like what are some steps that people can take at any level. And then for our clients, that work is further amplified, but that's really based on what the client's objectives are. So for example, um, we had a client earlier this year, Feeding America, and they have a cohort of food banks. And we came in and we did a day-long health equity training for this cohort of food banks that were interested in learning more about how do they address health equity, how health inequities in their community, how do they better communicate and engage with their community members. And so my team, we came in and we did a day-long training on that. So our client relationships are a little bit different because it really depends on what the client is asking us to do, for example.
Understood. So in the past, there was a TED Talk. Can you tell us a little about that?
Yes, so the TED Talk, it was actually generated from my research on obesity among Black women. And again, looking at those social and cultural factors. And really, the premise of the TED Talk was we don't have to throw away our culture to be healthy. We live in this westernized society that's saying you should only eat this way. And if you eat another way, that's bad and is frowned upon, etc. But I'm a firm believer that we don't have to give up our cultural foods. We don't have to give up our cultural traditions in order to be healthy. Yes, do we need to make modifications? Do we maybe need to do things in moderation? Absolutely. But I do not believe that we should have this deprivation mindset, like throw everything away that you grew up doing and knowing and love and embrace in order to, eat this other way. I don't think we have to do that. So that is the premise of the TED Talk, is encouraging people that, we don't have to give up our culture to be healthy. However, we can make some modifications. Like, for example, in the TED Talk, I provide some tips or life hacks, like around seasoning. Like, if you are going to use salt-based seasonings, only use one, or maybe just use a finishing salt at the end. Think about other food preparation ways that can make your food healthier, but still give you that same vibe that you're used to. Like, for example, I use my air fryer,
Hmm.
and that gives me the sense and feel of,
Like
a fried food, or,
yeah.
I just saw this on social media yesterday, and it said, these Black women, we need to get back into the kitchen and fry chicken like our grandmothers and get popped by the grease. And I'm like, no, we don't have to, fry chicken in the grease. You could put it in the air fryer and still get a similar feel. Or if you want to fry the chicken, then do it every once in a while, but not every night. And that's the whole thing. It's moderation for the things that you do not want to alter at all. But for the things that you can, try it. Instead of using a whole milk, maybe go down to a 2% or a low fat milk. Same thing for a cheese, for example. Um, and then focus on portion control. So instead of eating like two crumble cookies, maybe have a half every once in a while. So that's
Have.
really what
Yeah,
the message is.
but I can see you're saying there are options,
Yes.
saying that a lot of us, and not all of us,
Hmm.
because there are Black vegans and Black vegetarians and flexitarians and pescatarians, and it goes on and on.
Hmm.
But you're saying that we need to know that we have options and that there are ways that we can enjoy the foods that we were raised up, the comfort foods of our life.
Hmm. Yep.
We
Yep.
can enjoy the comfort foods without killing ourselves in the process.
Absolutely. Because these chronic conditions don't have to be inevitable. Yes, there is some genetic predisposition to these conditions, but there's a lot that we can do in terms of taking control over our health to help either prevent them altogether or help better manage them so you're not having to deal with the totally bad consequences of a chronic disease.
And I'm optimistic because we have a history where we were able to take the pieces of food that nobody wanted and turn
Mm-hmm.
them into gourmet meals. So I'm
Yes.
sure if we can do that with the pig ear,
Mm-hmm.
a pigtail, that certainly we can do that. We can use that same creativity, um, combine the spices and make vegetables and fruit and grains and beans just as enticing. I think we have it within us to do that.
Absolutely. Because, I mean, at the heart of the matter is food is a part of our culture. We center so much of our lives around food, whether it's good or bad. If you get a promotion at work, having a birthday or graduation, the first thing we're going to do is find a place to celebrate over food. If there's something bad that happens, maybe you lose your job, maybe there's a death in the family, or maybe you just had a bad day, a lot of people also turn to food for that comfort. But how can we turn to food for comfort in a healthier way?
Yes,
And how do we recondition our minds around how we around our relationships with food? And you mentioned something a few minutes ago about how we have been conditioned to take the worst parts of, the meat, animals, or whatever, and making something into it. But along with that also came a scarcity mindset. So always being concerned about not having enough food can also impact your relationship with food. And I think that's very much deep rooted into slavery, into poverty mindsets. And it's totally understandable because if you have grown up and not knowing where your next meal is going to come from, you are certainly going to start to adopt habits that, when food is presented to you, you're going to eat as much as you can because you don't know when the next one is going to come from. If you've been taught not to waste food, growing up, as you get older, you will keep with that mindset. So, eating whatever's on your plate to avoid wasting that food as well. So those are some of the habits that we have to be mindful of and to think about. And I think that gets translated in today's kind of diet culture of just don't eat that. But we gotta think about, why are people conditioned to think this way and feel this way, and then get at the real root cause of why is our relationship with food the way that it is.
absolutely. I think it begins with the conversation because a lot of times we do things out of habit,
Mm-hmm.
out a lot of thought as to what's motivating us to do this or to act this way or to eat like this. And so these conversations are really very important.
Yep. So the other thing in the TED Talk that I talk about is I came up with this acronym called EAT, which stands for Evolve Our Attitudes Towards Wellness, to just be a reminder of, when we are thinking about our health and wellness, let's think about our attitude towards it. And that attitude is going to drive your decision making. And then also making sure that, we have a friend or a partner, family member, that we're all committing to our health and wellness, and we're honoring our health and wellness journey. And I want to put the emphasis on journey because
Hmm.
this is a lifestyle. This is not a diet. This is not a fad diet or whatever. We have to, nourish our bodies, respect our bodies, and do what's best for us. And it's a journey because you're going to ebb and flow. Every day isn't, you're not going to have your perfect day every day, and that's okay. We have to give ourselves more favor and grace when we quote unquote fall off the wagon per se. You have good intentions and meal prepped all week, but then Wednesday comes along and you had a stressful week and you're like, you know what? I'm gonna have a glass of wine. I'm gonna have, a dessert tonight, or, I'm gonna have, something, right? Or I'm not going to work out today. We can't beat ourselves up over that and give ourselves unnecessary stress and worry over one decision. There will be more decisions. Now, the problem becomes when you get stuck in that decision making pattern and
Yeah,
it's
that's the
decision
problem.
after decision after decision after decision. But I don't want people beating themselves up when they feel like, oh, I've fallen off the wagon, in the wagon that you created or someone else created
Right.
for you.
Right. Yes. That's so true. It's an ongoing journey. I guess that's the key. We have to accept the fact that it's not a one and done.
Yes.
It's just not that way. I guess my greatest pet peeve now is the amount of processed foods that we consume, that we give our children, that have inordinate amount of chemicals and sugar and salt that can have long-term effects. And so I'm not as concerned if you're a pescatarian or you're a vegetarian or you eat it all, omnivore. I would just rather people cook their own,
Mhm.
to avoid all of that processing that we get when we buy from stores, when we buy from fast foods, even when we eat out.
Hmm. Yeah, I don't think people really realize what is going in their foods. And like you
It's another
saying,
thing.
cooking is obviously going to be your choice because you can control what goes in your food. And 9 times out of 10, if you're cooking at home, you're cooking whole foods, right? Even
Yes.
if you do deep fry the chicken, you are still, just frying the chicken in the oil. You're not adding all the extra preservatives and whatever else it is that these restaurants are adding to make the food taste good and to get you hooked on it and
And to make
addicted.
it last longer, right?
Right, and make it more shelf stable. So I think there's definitely some room for some education around processed
Absolutely.
and ultra processed foods, what their impacts are on people, and how do we balance those things? Because a lot of times people are choosing those options because they are the shelf stable options. They are the cheaper options, and
It tastes
they
better
can, and they taste better and they go
by
further.
design. Yes.
Yes, but we got to figure out, what are some of those strategies that we can help people find the balance. And we're actually, I'm glad you brought this up because our next campaign that we're working on right now is around ultra processed foods.
That's
And
huge. That's
yes,
huge. I'm excited for you.
and one of the worksheets that we are developing is like a swap worksheet to help people identify what are some alternatives. So if you're saying, okay, don't eat, chips, cookies, whatever, but what can I have in replace to satisfy that crunchy feeling that I want, that saltiness that I want? So we're developing like a worksheet to help people, make those swaps, as many times as they're able to. But really getting back, focusing on, buying whole foods and preparing them at home is definitely the way
That's
to
the
go.
key. I think part of the problem is that we either don't cook or we don't know how to cook.
Hmm.
If it's not something that we pop into a microwave or we can just take off the shelf, the whole idea of preparing a meal, you know, um, is can be foreign to a lot of people.
Hmm. Yeah,
And
for sure.
that's I think that's a huge challenge that we face. And I think also um there's a whole when we cook a meal, there's hopefully somebody that we can share it with, because this whole idea of just eating by yourself in isolation and eating for a certain feeling instead of eating for conversation and enjoyment,
Mhm.
all of that needs to be revisited. And I think having conversations like you mentioned with people to even get us to think about it. We kind
Mhm.
of do things automatically, but we actually start to think about, why do I do that? Well, why don't I? Why is it that I go to McDonald's versus make my own French fries? And so going from that, I think is a huge step. And I think you're definitely on the right track with all of that.
Absolutely. I think the part that you were saying about the community piece and that conversation piece is so important because that also forces us to slow down and take some time out. And having that family time, friend time, or whoever time allows you opportunities to decompress, to talk about your day, to build stronger relationships with people. And again, you're still doing it over food,
Yes,
but
yes.
just in a different way. I've seen, some people suggest, instead of going out, let's do a potluck at one of our houses and everybody bring their, favorite dish or something like that. Because then we can still get to hang out together, but just doing it a little bit different. Or even if you do go out to a restaurant, think about like sharing stuff,
Yeah.
sharing the appetizer or, picking healthier items, taking half for now, half for later, etc. So I think there are a lot of different strategies at every level that people can consider. And the accumulation of those healthier decisions will have a huge impact on our livelihood down the line.
Yes. This has really been fascinating because it's one thing leads into another, which it's like it just grows because this whole conversation of how you eat and preparing and not giving up all of your options, it ties into community,
Mhm.
which ties into the bigger concern of I think it's loneliness. I think it's the Surgeon General that came out and said that loneliness is a huge factor for so many of us. And what you're doing, which seems um, almost seems like a given, is actually touching on all of those aspects. And that's huge. And that's really admirable.
Thank you. I think in today's digital age, that loneliness is getting higher and higher for people because we're becoming more and more isolated. And of course, COVID did not do anything to help isolation at all. And actually, a very strong predictor of your health outcomes is your social network.
Well,
And that's because you have people that you can lean on in good times and in bad. So let's think
I'm
if you
tempted.
need a ride to the doctor's office,
There's
if you
somebody.
have a social circle and someone can take you, then you're more likely to be able to get to that doctor's appointment versus if you had no one. If you
Right.
have someone to talk about, this was my experience at the doctor, this is what they're telling me. Have you had something similar happen to you? Let's talk about it. Or having that support in terms of, um, even looking at food, like, okay, well, you cook one night, I cook one night, and then we can
Share
have,
a meal. Right. Yeah.
yeah, share a meal, building the community with each other. So having that social network is important. And you also have people who are checking in on you and checking on your
Yes.
well-being, and they
Yes.
are invested in you
Yes. I
and
heard
you
the
own it.
question was the question that you need to ask yourself. Is there someone that you could call at 2 o'clock in the morning if you needed to?
So here's the thing. You could call me at 2 a.m., but my phone won't be on Do Not Disturb. But if you are in my favorites, then you will get through. But that's a really important question because it goes to show if you are in distress, if
Yes.
you are in need, do
Yes.
you have someone, anyone that you could call? You might have to call them a couple times and wake them up. But, will they answer and see the urgency of, oh my gosh, Giovanni's calling me. Something must be wrong if it's 2 in the morning. Let me see what's going on with her.
Yes.
Yes.
Yes. So what's next on your plate? You've done so much already. What's
So
next?
next for me is really growing my business in
Mhm.
both folds in terms of building my client base and the offerings and provide that we provide our clients, but
Yes.
also building up our own portfolio of work so can increase the credibility of Beacon Public Health and that we become a go-to resource for Black and Brown communities to get their information about health and wellness.
Okay. So for anyone that didn't hear your information. Tell us your website, tell us contact information, tell us who should be searching for you.
Everyone. No. So website, beaconpublichealth.com. Again, you can find any of our resources and materials available free of charge. Please download them, share them with others. You can reach out to us by email is at info@beaconpublichealth.com. And you can also follow us on social media on LinkedIn, Facebook, and Instagram at beaconpublichealth.com. Those who are interested in working with us, definitely reach out. We, have a whole host of services that we offer, ranging from helping you build up your organizational capacity, building public health programs, evaluating them, health education and communication as well. So if you are an organization and you are in need of those services, definitely reach out there. Also, I recently was a part of a book around public health entrepreneurship. So if you are interested in figuring out if entrepreneurship is the right way for you,
Yes.
definitely go to my website and click on the public health entrepreneurship book and get you a copy. And then you can definitely reach out to us if you have any questions about public health entrepreneurship. And then you could sign up for our newsletter as well, just to stay in contact with us and get updated on the things that we're working on.
Fantastic. One of the best things about doing this podcast is that I have the opportunity to meet people who are really making a difference, that are sincere, that have our well-being at heart. And it's always a positive experience. So thank you for coming on to the podcast. Thank you for sharing your information. And I personally hope that we stay in touch.
Absolutely. Thank you for having me. This was a great conversation and a great way to start my day. So I'm really excited that you have this platform to elevate different voices and just to make sure that, we have resources in the community that we could tap into so we can all live our healthiest lives.
Okay, so I won't say goodbye then. I'll just say until the next time. Take care.
Absolutely. Talk to you soon.